Hi, this is Dr. Sara Siddiqui from the NYU Langone Huntington Medical Group. I'm recording a pre-recorded video regarding the um, tips on the reopening of schools and how to prepare your child and the family to prepare for the reopening of schools in September. I just want to say that this does not replace any, my advice or the discussion here does not replace any advice given to you from your own personal doctor or pediatrician. It's very important to discuss all medical issues with your pediatrician or medical provider. And I'm not representing any entity. I am just giving advice on behalf of the American Academy of Pediatrics and as a pediatrician. So, having said that, I wanted to thank the Elwood Public Library for allowing me this forum to communicate and about topics that I feel are important to discuss and important to involve people with the discussion and make sure that information gets out there. And unfortunately, this isn't going to be live, but if there are any questions that I can answer afterwards, I will be sure to try to answer them. So be sure to check back and look at the answers of anything that I can provide. And of course, if you have any topics that you wanted to cover in future Facebook Lives with the Elwood Public Library, please reach out to them. They're very helpful, and I'll be sure to try to address those topics as well. Okay, so I kind of made a list of top 10 things that I wanted to kind of cover and make sure that we get through those items. And but number one is that it really will depend. School reopening in the fall will depend on our local numbers. So in New York State, we currently have local case count rate of COVID-19 at 1%. And the guidelines do state that if we remain below 5% for 2 weeks leading up to the opening of schools, then we will be able to reopen. Once we do open, there are guidelines suggesting that we would be up to 9% positivity rate, and then we would need to close. So the number one important thing to remember is to make sure that we know what the local case count rates are, and make sure that we also know your own personal health and medical history and your child's medical history regarding the return to school. So, of course, each school is going to have a distance learning, a hybrid plan, and some schools may be able to offer full in-person learning all 5 days. So, depending on your history or history of medical issues in the family, you may decide that all in-home learning would be best for you, and that's fine. So my number one tip is that once you kind of decide based on health history that you would like to go in-person school, even if it's a hybrid plan, or you feel that 100% in-home school would be better for you, then that's the best decision for you. So we need to remember that each family has their own personal medical issues that need to be kind of the supreme factor as to whether you're returning to school or not. And even if the decision is that you need to stay home for health reasons, then there is an option for you to receive home instruction as well. So whatever you decide is the right decision for you and your family. So that's number one that I want to really stress about, and that's the I guess most important decision that we all have to make. Once, and you can talk to you can talk to your provider, your medical provider, your pediatrician. For adults that may be not healthy or don't want to be exposed, then you want to talk to your doctor regarding that. But that is the most important decision that needs to be made first. And once you kind of have made that decision, then you can go on to move forward and start to plan for the upcoming opening. So, but really, it's the most important thing is to keep your family as safe as possible. And having said that, we do want to make sure, as and I always try to tell patients this too, return to school is important for students, for our students, our community in general, but most importantly for our students. But we have to know that it's not going to be with zero risk. So what we're trying to do is mitigate risk or try to help reduce the risk as much as possible. So then the rest of the guidelines are to do that, are to not reduce the risk. It's not going to be zero, but it's going to be to try to reduce the spread of the virus as much as possible. So that was kind of the number one most important thing that you kind of have to discuss and make sure and you figure out. The second thing that I wanted to make sure that I highlight is that you want to start talking to the children or talking to your kids about, and I'm sure probably most of you already have, but about how school will look, about how it may look a lot different than what it was when we left in the spring or in mid-March. So we do want to start preparing our children to know that it will look a little bit different. There'll be, the desks may be spaced apart. We may have less students in the classroom. We may be eating lunch in our classroom. So those kind of things are things that you want to discuss prior to the beginning of school. And it's important to make sure that we kind of know the differences between each of the things that are being offered. And it's also important to stress to children and to family members that this is a fluid situation. That's so I always have sayings that I kind of use in my office a lot, and they kind of change ever since the pandemic started. So it changes. So I was using unprecedented, I was using challenging times, I was using the new normal a lot, that we have to adjust to the new normal. And now my latest phrase is that we have to kind of be prepared for or accept the fact that everything is fluid. Nothing is kind of set in stone. Nothing is really, this is how it's going to be. There's a lot of data that comes out on a day-to-day basis, and based on that, we have to be prepared for change, and we have to be prepared for a fluid situation. The fluid situation. So the situation is constantly fluid. So I think fluid is a really nice word to describe it, because I think it makes us feel like we're kind of suspended, but we're definitely, like, it's a comfortable suspension, I guess, that we're all kind of feeling. So I like to say fluid, and that's number 2. So just be prepared for change. The third thing I really want to stress and highlight, and one of the tips that I want to go over, is the masking recommendations. So in school, we most likely, we most likely will have children and adults wearing masks. So you want to make sure that you get one that's comfortable for your child, that you have several on hand because they should be washed daily. Go over how to put on a mask, take off a mask, make sure to, when you're putting on the mask, to not touch the front of the mask, to make sure your nose and mouth are covered, and that the mask goes behind the ears, and that it's also important to start practicing to wear a mask a few weeks before school starts. So definitely start practicing as soon as you can. Start doing 10 minutes once a day and work your way up to twice a day or 3 times a day for 10 minutes each, just like you would with any type of exercise or activity program or anything that you're going to start something new that you're going to start, you start slow and you kind of work your way up. That's what you're going to do with masking. But first of all, it's important to get the correct gear, the correct size mask, the correct fit mask, and there's so many different options. Any type of cloth mask is great, and the thinking that it might be uncomfortable, or that the feeling of like you're not able to breathe through the mask is really more about getting used to the mask. It's very difficult. The cloth mask especially, and even the surgical masks, those are very breathable. It's very easy to breathe through, but it does require some practice. So it's really important to encourage your child to try to practice it, and you can try to practice it too at home. So masks, there's probably so much more I can say about masks, but feel free to ask any questions and I will try to answer them when I get them. Hand hygiene, so this is an important thing to discuss with children. So it's really important to stress that hand washing is so important during the school day. So if you can't get to soap and water, then hand sanitizing is very important, especially prior to mask, prior to eating or drinking, or prior or before and after doing any activity. We want to really stress washing our hands a lot. And that's very important to not only prevent the spread of COVID-19, but many of the other school-related viruses that we tend to see once school starts. So with our masks and increasing hand hygiene and the distancing also is all going to help reduce the spread of the normal viruses and bacteria infections that we see during the typical school year as well. So we're hoping that those kind of things will reduce also. The fifth thing I wanted to point out, or I wanted to touch on, is to be sure to get to your pediatrician's office or your family medical doctor and make sure that your immunizations are all up to date. Get that physical exam in, because it's still important to keep up to date with all your normal routine care. So it's important to take this opportunity over the summer to go visit or go talk to your pediatrician. We're here to help you, and we can help to give you any advice that you may need regarding return to school, or any type of optimization of your care. So, but really it's important to reach out to them prior to the beginning of school to make sure that all your preventative needs are met. And I'm also telling my patients, to even the parents, to go get their healthcare taken care of now, because now's the time to do that. The number 6, what I want to also stress is the importance of, even now leading up to school and even when school starts, is the importance of staying home if you're not feeling well. So especially, we are going to have temperature checks and checks on how you're feeling prior to coming into school. So it's really important that if your child has a fever or any accompanied with cough or congestion with fever or body aches or pains, abdominal pain, vomiting, those kind of symptoms that you get that you don't go to school, and you get in touch with your pediatrician or your medical provider to discuss what your options are, what you need to do, whether you need to get tested or not tested. And I will get to a little bit later on guidelines regarding that as well. But it's really important to stay home if you're sick. So adults and children, it's really important that if you're not feeling well, to not come into school and to get in touch with your medical provider. Right, so the next thing on my list is the guidance for quarantine and isolation. So after you've, thankfully our rates right now are very low, and that means that we're not seeing that many COVID-19 cases, which is wonderful, but we want to keep it that way. So if we do find that there is a positive case, or if anyone's been exposed to someone who was positive, you want to contact your doctor. You want to make sure that we discuss what types of isolation or quarantine is recommended. So if you've been in contact with someone who was diagnosed as positive, COVID-19 positive via nasal swab. So that's the swab that goes into the nose. And that's the test to determine whether you have virus that may be causing your symptoms. That's the reason you got tested. So if you've been exposed to someone, that means that you were within 6 feet of them for longer than 15 minutes. It's 10 to 15 minutes. So some guidance is 10 minutes, some guidance is 15 minutes. But if you've been in contact with them, close contact with them, so if it's a family member, it is recommended for you to get tested, or at least isolate until you can get tested for 10 days. And it is important to remember that if you do have positive results, then you do also have to isolate yourself and inform your contacts up to 48 hours prior. So 2 days prior to either your symptom onset or 2 days prior to your test, if you were not symptomatic, 2 days prior to when your testing was. And this is, this is when it's going to depend on the local numbers. Again, if our local numbers start to rise and more people are testing positive, things may shut down. And this is where the fluid nature of all this comes into play. Hopefully, with more testing, we will be able to isolate people that are positive and kind of control the spread. But sometimes it can come to a point where more and more people are testing positive because we didn't realize how much of an exposure was going on, and then things may need to shut down. There may need to be classrooms shut down or entire schools shut down for up to 2 weeks. And this is going to become this guidance is most likely going to be coming from the Suffolk County Department of Health based on local data. And that's where it's going to be really important to stay in touch with your local pediatrician or physician, because testing is going to determine how much positivity is going on. So again, the fluid nature of all this is going to be really important, and to be willing to some days we're going to be staying home, some days we're going to be going to school. So it is going to look a lot different. Again, it's really important to know that it's going to look different than it was in March. Will we come back to the regular normal that we were used to prior? Yes. Will it be, how long will that take? We don't know. We really don't know. Let's see, what were we up to? Number 8. Number 8. I actually learned this. I was on a call with Dr. Diaz, who's a psychologist, child psychologist, and she really brought up an important point when we were talking about return to school and how setting your routines are so important. So routines help to keep us structured. And so it's really important to start those routines soon, because all of us, and myself included, have kind of gotten out of the routine, right? So we haven't been in school since March, and then we did some hybrid distance learning, but it wasn't, it was a lot different. And then the summer kind of started, and so our routines have kind of gone all over the place. I know in my home they have. So it's really important to start a couple weeks before school starts, just as you would any normal school year. So even last August, when I did my return to school tips in my office, the routine of starting school is really important to start soon. And children actually do very well. Children and adults do well with routine and structure. So it is important to start, on Monday, maybe 2 weeks before school starts. And start, getting up and kind of just starting a routine: breakfast in the morning, lunch in the afternoon, dinner at night. And so it's important to start establishing those routines sooner rather than later. And the other point I like to encourage along with those routines is some reading. So make sure that we're starting our summer reading or in the middle of our summer reading, and make sure that the children are doing something to kind of prevent that summer slide, or in this case spring and summer slide. And that should be established into your routines too, or try to. And then, so I kind of put in number 9, that summer reading was number 9. And my last point is really what I've been talking about throughout, is just be prepared for the changes that are about to happen. So school is going to look a lot different than what we're used to. It's going to look it's difficult to say how it's going to look, but be prepared for the change that be prepared for it to be different. And the schools, I know our district is going to be having videos regarding how the inside of the school will look, how the pickup and drop-offs are going to be, how transportation is going to work. So all those things we need to kind of preview and make sure that we have an idea about before we start school, so we're prepared for those things. But be prepared to make adjustments. Sometimes some days will look one way, and some days it may look a little bit different, so we have to be prepared for those differences that are going to occur. And I think that if you kind of prepare a little bit with regards to some of the things that are going to be appearing different, it might make it easier for us to accept the other things that may happen during the time after we start school. So I hope this was helpful. I guess the main point would be to decide what you're going to do regarding school. Are we going to return full-time or the hybrid way, or are we going to be at home? And I can't stress enough that whatever you decide is the right choice for you. And I hope everyone is staying healthy and active and happy, and trying to enjoy some of the outdoor time that we have now, and be prepared for everything to start, but be prepared for change. And I think that's the most important takeaway, I guess, that I can make. And that's what I try to tell my patients at work, and that's what I try to tell myself, honestly, because we don't know. And one of the first things that I usually start when I talk to people, or even when I talk to my patients, is that as of today, and today's I'm recording this on August 9th, so as of today, what we know may be different than what we know in 2 weeks. But what is important is that we continually try to mitigate the spread of the virus, continue trying to wear our masks, continue to maintain our social distancing, and continue to wash our hands. And then we hope for the best. So on that note, I will leave you, and I hope everybody stays well and happy and healthy. And I hope that this video helped a little bit to give you some tips regarding the reopening.